6 months into the global coronavirus pandemic, state and local lawmakers across the country are beginning to contemplate legislation to specifically authorize and provide statutory guardrails to govern compulsory social distancing and face covering orders by executive branch officials. My name is Lindsay Wiley. I'm a professor of law and director of the Health Law and Policy program at American University, Washington College of Law. In a paper I'll be presenting at Harvard Law School's Health Law Workshop on September 14th, I propose that legislatures embarking on the politically fraught process of codifying the law of social distancing should adopt a principle of democratization, emphasizing transparency and accountability alongside individual protections. Measures that target entire classes of businesses, closing bars or indoor dining or gyms, or freezing evictions, as the CDC recently ordered, are fundamentally different from orders targeting a specific facility to control a specific outbreak. Orders directing the general public to shelter in place or wear face masks are different in kind from the targeted public health orders for compulsory quarantine, isolation, testing, or vaccination of individuals. Compulsory social distancing orders and face covering mandates do not fall neatly within specific statutory grants of authority the way isolation, quarantine, and compulsory testing do. These measures are not governed by the substantive statutory requirements and procedural protections that are designed to protect the rights of individuals from targeted intrusion by the state under the banner of public health in a public health emergency or other infectious disease scenario. Most courts have taken a highly deferential stance toward COVID emergency orders, finding that statutory requirements governing the definition of an emergency, and in some states, statutory requirements that measures must be reasonably necessary, sufficient to withstand constitutional and statutory challenges. But some courts have found these minimal guardrails inadequate to guarantee that executive authority is wielded according to proper delegations of power and policy guidance from the legislature. And as the pandemic wears on, more courts may lose patience with the emergency response framework that bypasses ordinary legislative and rulemaking processes. So now we're seeing the beginnings of legislative efforts to constrain executive authority by imposing new time limits, new substantive requirements, and procedural protections on the general powers of state and local officials to control the spread of communicable disease. Current efforts are concentrated at the state and local level, but following the CDC's boundary-pushing eviction freeze order, we may see something similar at the federal level in coming months. In my paper, I draw lessons from 3 sources to inform my recommendations for mid-pandemic and post-pandemic legislative reformers. I look to the growing body of judicial opinions adjudicating legal challenges to COVID emergency orders. I also examined the rich literature on public health law and ethics, as well as political theories of emergency politics. As they refine the limits on emergency executive powers in the coming weeks, months, and years, I urge legislators to consider 4 key principles, which emphasize democratic accountability in ways that existing substantive and procedural protections applicable to individually targeted public health orders do not. First, because widespread voluntary cooperation is the primary means of securing compliance, even for measures that are purportedly mandatory, legislatures should provide clear requirements for transparency and communication, which are critical for securing the public's trust. To ensure executive officials' use of compulsory powers is conditioned on a demonstrated threat of significant risk and a suitable fit between the means and clearly stated ends, this communication should require statements of the strategic purpose orders are intended to serve, the scientific understanding on which they are based, and the criteria that will be relied on to determine whether they're working and when they can be lifted. Time-limited but renewable orders should ensure that these statements and reporting requirements are periodically updated. Second, public health statutes, I argue, should provide executive officials with a graded range of alternatives to ensure a suitable emergency response that can be tailored to adjust to evolving conditions and evolving scientific understanding. To facilitate a scaled response, classifications among businesses and activities should ideally be developed in advance by the legislature whenever possible. Third, legislatures should provide statutory guardrails to ensure orders are neutral laws of general applicability that do not discriminate on the basis of religion or unduly burden other fundamental rights protected by the Constitution. Finally, to enable widespread voluntary compliance and minimize unjust distribution of the benefits and burdens of public health regulation, restrictions and mandates should be accompanied by facilitating supports, legal protections, financial supports, and accommodations to enable compliance and minimize harms. I recommend that legislatures require executive officials to implement supportive measures and guidance about safer alternatives to restricted activities to the fullest extent possible within available means. In some ways, we've been here before. In the decade following the jetliner and anthrax attacks of 2001, Congress and state legislatures across the country passed hundreds of bills to specify the emergency and public health powers available to executive branch officials and to provide statutory protections for individuals subjected to compulsory medical examinations, testing, quarantine, isolation, and vaccination, as well as seizures of private property. Social distancing and face mask orders, which had not been widely used in the US in decades, got little attention from post 9/11 reformers bent on modernization. The result, hundreds of community coronavirus emergency orders resting on older, broader grants of authority with very little guidance from the legislature, has caused confusion and consternation in the courts. Now we're on the cusp of a new decade of legislative reforms. Some public health experts may prefer the status quo, leaving health officers, mayors, and governors to rely on broadly defined powers to control the spread of communicable disease without imposing any new statutory constraints on their use. But if public health advocates wish to be a part of the impending legislative debates that are just now beginning to emerge, they'll need to offer something as an alternative to proposals to strip executive officials of their public health powers entirely. In the paper I'm presenting at Harvard Law School's Health Law Workshop, September 14th, I'm seeking to achieve a balance between public health protection and democratic accountability that will ensure health officials and elected leaders they advise are equipped to handle the next stages of this pandemic and the next one. Thank you.